Hey, this is Jared Moss with Regional Urology. We wanted to bring another video to you guys today. Some of the previous videos that we've done have talked about digital rectal exams, PSA, and prostate cancer. This is Chris Warren. This is my uncle, so this is a personal video for me. But I had reached out to my uncle to basically say, hey, would you be willing to share your story with other men to try to help them understand what is prostate cancer screening, why is it important, and how can it affect people's lives? And I know for us, I remember as a young child, I was a ring bearer at your wedding, right? So
absolutely.
So we go back quite a ways. Chris is a realtor here in town, and you may be familiar with some of his Facebook videos that he's posted, and if you've seen him. But without further ado, we just wanted to talk just a little bit about your story. So if you had to describe your story to people, what do you tell people?
Oh, gosh. Prostate cancer is not something that is in a lot of guys' vocabulary when they're in their middle ages.
So how old are you right now?
55.
And when were you diagnosed?
A little over 10 years ago. I was 45 years old.
So you're a 45-year-old guy. You're a white male, which is significant because that's a lower risk category. In any family of prostate cancer history?
No history.
So you're very low risk for prostate cancer,
Very
right?
low.
Young age, and we know that African American men are more, that's a population we have to be careful, we have to screen a little bit more aggressively because prostate cancer is more common and it's also more aggressive. So in other words, we're saying, you know, Chris really fell into a category that, is it fair to say, probably a lot of people are missing?
Absolutely.
Okay, so I think that's the big message that you want to send is you were initially in a population a lot of people weren't even getting checked for.
No, that's correct. I mean, I was doing annual physicals for as long as I can remember. They do the blood test, urine test. You have really no idea exactly what all they're testing for. And it was a little over 10 years ago that they didn't tell me, I'll see you again in the next year. They called me up and said, hey, your PSA's really elevated.
Did you know what a PSA was?
Absolutely not. I thought public service announcement. I don't, these are not things that I was into.
So you were like, okay,
This
there's some
wasn't
lab
in my
abnormality.
vocabulary.
I just need to go follow my doctor.
Well, no, they did. They explained to me
Okay.
that elevated PSA could mean a lot of things. It's more of a screening and indicator of, multiple possibilities, but it is a screening for prostate cancer. So I did need to go see a urologist immediately.
And so who'd you see?
Dr. Moss, one of my favorite urologists.
So that was my dad, and
Yeah.
I'm sure a lot of you guys
We kept it in the family.
Yeah, may be familiar, but Dad initially saw Chris at that time, which was now right 10 years ago. So what
correct.
happened then?
We got news. I got news from Jimmy, Dr. Moss, that we had a positive for prostate cancer.
So how long? So you came? Did he repeat the PSA and then get you set up for a biopsy, or did he say? Did he do a rectal exam? What did he do?
Yeah, there were several tests
Yeah.
that were ran. And it's been a while, but there was multiple things done before we actually got to the biopsy stage. But the irregularities that they were seeing were all leading to the conclusion that this was prostate cancer.
And the way that prostate biopsies were done when Chris had his, we do them a little bit differently now. Most of our prostate biopsies now are done with propofol, which is similar to having a colonoscopy. So it's not an experience that you're aware of what's going on. You're very comfortable. Prostate biopsies typically don't take that long, and it takes somewhere between 4 to 5 days to get the prostate biopsy results back. So I guess Dad sat down and went over the prostate, the biopsy with you at that time. I mean, how did that go?
Yeah, I mean, we had to have some conversations at that time. I do recall just the news, and how does that, how do you react to that?
At 45.
At 45
right.
years old.
No other health problems.
No other health problems, and you're not thinking of anything. You're not thinking of prostate cancer.
Right.
That's the old
furthest
man's
thing.
disease
Right.
that normally people don't worry about till they're 60, 70, 80 years old. Or at least that's what
People
the
perceive,
consensus.
right?
That's,
Yeah.
that's the perception. So, and for me personally, it wasn't so much about me. It's more about all the people that are around me.
Sure.
The family and the friends and everything, and you don't know what's going to happen. So you have to have those deep conversations with your physician and talk about options. I don't remember all the numbers and
right.
everything that were
It's
given
been a
me,
while,
but
right.
it was an aggressive increase in the 1 year to the next, and being 45, I mean, we wanted to go at it head on.
Right, this was not, so, I hear a lot of times from patients when I'm seeing them say, well, gosh, doc, don't people just die with prostate cancer? They don't die from prostate cancer, right? And I say, no, that's not necessarily true, right? There is some prostate cancer that a lot of men will die with, and that's not the type of prostate cancer that we treat. But for you as a young man that had some aggressive prostate cancer, this would have certainly,
I mean, I feel very, very
taken
blessed
your life,
that I did the annual
right.
physical, and it's as simple as that.
Right, a blood test. Right, simply a blood test to come in, and then in some of the other videos we've talked about why it's important to still get the rectal exam, because in rare instances, aggressive prostate cancer doesn't make PSA. So, those are the two things that basically you need, the rectal and the PSA, which is a blood test. So you ultimately chose to have your prostate removed, is that correct?
That's correct, yeah. We went through...
you had it done with a robot, is that correct? And so
sure.
How long were you in the hospital?
Oh gosh, it seems like they had me up within hours. They want to get you moving.
Did you stay in the hospital overnight?
I think it was overnight.
Yeah, overnight.
As far as I recall.
And then you typically wear a catheter, right? About
Yes.
2 weeks-ish.
Right. Wasn't no problem with that.
And a lot of times the men will tell me that the worst part of the surgery for them was wearing the catheter. That
Right.
It's not a fun and pleasant experience, but when the bladder is separated from the urethra to remove the prostate, and then you put everything back together, you have to have some scaffolding for the tissue to heal over, and that's the purpose of the catheter.
Sure, it's an inconvenience,
Yeah.
but it doesn't limit you. You're out and about, so you have the means to have it with you and without
Get out about, do what you need to do.
Being in public, sure.
And so once you'd healed up from surgery, then you actually elected to have radiation as well, right?
That's correct. Yeah, we go through a lot of discussions, and there's options out there. So you have to have the talks and make the decisions on what's going to be the best path forward for you. And in the case of where I was at, we're going to have the surgery and follow up with radiation.
Mm-hmm. And so sometimes we'll say that when you remove the prostate, the seminal vesicles, and the lymph nodes, you have to make a determination at that time based upon the patient's age, their health, some of the features. If they're high risk for having a recurrence, a lot of times men will be more aggressive and get radiation after they've healed up from their surgery, kind of as a protective mechanism, right? There was no sign that the cancer had reoccurred, but it was more to say, hey, there are some features here that might make his a little bit more high risk for having a prostate cancer recurrence, so we're going to do that radiation up front.
Sure.
And so there are other men sometimes that will wait and have radiation at a later date possibly, but that was something that you chose to do. And how long was your radiation, do you remember approximately?
I don't know the number. It seemed like a couple of weeks of every day.
Every day you come in, and
it's
pretty
takes
quick.
5 minutes.
Yeah, 5 minutes for a treatment.
We're very good with that, and you don't really have any significant side effects. Maybe it makes you a little bit tired, which is not unusual for me.
Sure. And for you also had your testosterone turned off at the time, right? So a lot of men that are undergoing radiation only, Chris's circumstance was a little bit unusual given his age and the type of prostate cancer that he had, but a lot of men that are receiving radiation only will have the testosterone turned off during the radiation. That's because the testosterone feeds the prostate cancer. So if you're turning the testosterone off during the prostate cancer treatment, you're actually starving the cancer while you're also treating the cancer, so it can make you feel pretty crummy.
Absolutely.
Right?
Yeah.
I mean that's the truth.
Yeah, and I think that's probably of everything through the whole situation. It's what I remember the most.
Yeah. From
hot flashes at night to just being tired. So yeah, it can hit you a little bit hard for having your testosterone turned off. So.
But eventually your testosterone came back. You recovered, and now you're being seen, how often is it, 6 months, yearly?
Once a year.
Once a year, that's great. And so not had any signs of prostate cancer recurrence, and so this is all good, but I thought it was important to bring you in and just kind of, anything that you think that, is a bit of parting advice for people to say, these are things that I feel like are really important to me to get across to people?
Yeah, I mean, First, I think the whole general idea that prostate cancer is an old man's disease, that it's not something you need to think about, before you get to your 60s, 70s, or 80s.
Right.
In my story, it happened at 45. So.
No family history, no
family
other health
history.
problems.
Correct. Yeah.
I mean,
so
that's
if if there's one person out here that hears this and says, I'm not doing an annual physical, but I think I need to start doing that, then that's what this is about.
Absolutely. Or there's somebody who says, well, wait a minute, my uncle, has prostate cancer, which I'm going to start at 40 for myself, given that I have a family history of prostate cancer, or somebody says, well, I need to go get checked. I've never been checked. So it does. If it saves one life and it gets men talking about it, then I think we've accomplished what we're trying to do. Thanks for coming in. Appreciate it. Thank you very much. If you have questions or comments, please leave them, and we'll try to get back with you. Thanks.